Today's date is February 7th, 2019. This is Karen. Good morning, Karen.
Good morning.
And Karen initially entered the office. Karen's been a patient for many years, but in 2010, which is now 9 years ago, she was complaining of left shoulder pain. And at the time, we did send her for an MRI scan. Is that correct, Karen?
That's correct.
Yep. And in 2010, I'll just show a little summary. In 2010, it says that Karen had mild overall glenohumeral or left shoulder osteoarthritis, marked appearance of chondromalacia over the superior posterior aspect of the head of the humerus, and there were 3 loose bodies, and then there were other findings of tendinopathy, etc. Well, Karen, correct me if I'm wrong. The process of you caring for your disabled son continued, which involved lifting and carrying and moving and all those things, correct?
Not only him, but a lot of, medical products to take care of him as well, and supplies.
Yeah, so Michael is profoundly handicapped. So Karen's been caring for her, at the time, 24-year-old son in 2010
Right.
for 24 years on a full-time basis. And then her symptoms continued to get worse into 2016. And so we asked Karen if we could get another MRI done of her left shoulder in 2016. Correct, Karen?
That's correct.
And here's the results. Karen at the time now is 68, and 68-year-old female with left shoulder pain, decreased range of motion, ongoing for 6 months. And so the MRI scan showed the following, and this is lengthy. It was an arthrogram of her left shoulder with multiple findings, loose bodies, contrast, distends joint capsule, broad-based areas of prominent soft tissue thickening, capsular recess is in keeping with marked synovitis, and humeral head, grade 3, focal areas of grade 4 chondromalacia, thinning, irregularity of the humeral head, etc., etc. And then the AC joint, moderate chronic degenerative hypertrophy that's encroaching on the anterior subacromial space. And so the impressions by the radiology was advanced osteoarthritis. So it went from mild in 2010 to advanced osteoarthritis in the left glenohumeral joint. And she initially had 3 loose bodies. Now it's saying she has a dozen loose calcifications, loose bodies in her subscapulary recess and biceps tendon, and moderate supraspinatus, inflamed tendinosis, etc. Well, then it was so severe. Karen, tell us how severe the symptoms were at this time now with your functionality of your left shoulder.
Well, I couldn't lift anything without being in severe pain. I couldn't lift Michael up. I couldn't hardly dress myself because I couldn't get my arm behind my back about any further than that. And the pain was just debilitating. I seriously couldn't do much of anything, especially left arm.
So, and it was difficulty sleep. There was difficulty with sleeping too, right?
Right, because the pain never went away.
Right. So we had another conversation, correct? And we decided that maybe we should get a surgical assessment of your left shoulder, true?
Yes.
And do you want to just share what you recall of that visit at Mayo Clinic in Rochester?
Well, it's a while ago now already.
It's been 3 years.
3 years already. But when I went down there, they did, I don't know if it was an MRI again.
They did a full assessment.
Full assessment, and the doctor told me that he recommended a shoulder replacement surgery and set me up, I think, just like a couple of months later for surgery. But then I found out, either from him or from some further research of my own, that sometimes shoulder surgery leaves you incapable of really functionality after that too, and it might not be any better than it was before. And I just went, pooey, I'm not going to do that then. I don't want to go through a surgery and not be able to
do life.
to do life or be any better off than I currently was. So I opted out of it and came to see you.
So before we proceed, do you mind if I just show that letter from Mayo quickly on the summary of your visit to Mayo Clinic here?
Absolutely.
Okay, so here's the here's just the summary. Thank you very much for referring Karen, et cetera, and then it says left shoulder glenohumeral osteoarthritis, possible underlying inflammatory arthropathy versus a primary synovial disease. And then they go on to share the visit, and Karen and I were just reviewing this a minute ago, and here it says her x-rays and MRI show evidence of end-stage joint degeneration, and interestingly, she's had a lot of synovitis, i.e. inflammation of the joint, chondral loose bodies along the bicipital sheath, as well as inferior recess of the shoulder and the interval region. And then so his recommendation here says left shoulder glenohumeral osteoarthritis, underlying inflammatory, and he's then recommending surgery and, as Karen mentioned, arthroplasty, i.e. total joint replacement of the left shoulder. And as Karen said, there were so many